Hello everyone, my name is Rebecca Angasa and today I will be talking about a case presentation of a patient that I encountered during one of my clinical rotations. So the chief complaint of the patient is Mr. SJ. He is 40-year-old Caucasian male. He presents to the clinic with complaints of shortness of breath, sore throat, pain on swallowing, productive cough with brownish sputum for the past 2 days. History of present illness. Patient is alert and oriented times 4 to person, place, time, and situation. He is a good historian and he provides reliable subjective data. Mr. SJ complains of sore throat, shortness of breath, productive cough, pain on swallowing, and coughing for the past 2 days. According to the patient, the pain is in the left, middle, and right side of his throat. The pain has been constant and it worsens with swallowing, both solids and liquids. The patient stated that it is even difficult for him to swallow his own sputum. Patient describes the pain as achy when swallowing, rated the pain 5 on 10 constantly and 9 on 10 with swallowing solids and liquid. Patient stated he has recently had intermittent fever for 2 days, with the highest documented fever being 103.8. He complains of tenderness and soreness to bilateral tonsillar lymph node. He has productive cough with brownish discoloration and stated it is very difficult for him to even cough out mucus because of the pain. He denies recent travel or being around any sick individuals. He lives alone and he has a girlfriend. For the patient, he has been treating himself with Tylenol and he also gargles warm cold water, but the symptoms persisted and has not improved. So he decided to visit the clinic today and he denies any smoking or use of any recreational drugs. Patient's mother is still alive. According to the patient, she's 62 years old. She has a medical history of hypertension. The father is also still alive. He's 70 years old. He's a veteran and has medical history of PTSD, sarcoidosis, diabetes type 2. The grandparents are no longer alive. They passed away per patient 2 years ago. They have no medical history. The grandpa passed away in a motor accident. He has three siblings, one brother aged 35, and per the patient, the brother is autistic, and two identical twin sisters, both 22 years old, with no medical history. No family history of substance abuse. Patient is divorced with two children, two boys, denies any alcohol usage, does not smoke cigarette, and denies the use of recreational or illicit drugs. Patient drinks alcohol, specifically red wine, occasionally. Patient is a lawyer. He is self-employed and owns his own law firm. Mr. SJ is a Christian by faith and he attends Catholic Church together with his family. He has a dog and a cat and he loves them so much. He also loves to travel. He loves to exercise. He has a fitness center at home and he exercises in the mornings and in the night. So he says when he gets up in the morning, the first thing he does is he exercises. And by the time he goes to bed, he exercises, then takes his shower and goes to bed. That is like his routine. He doesn't limit himself to any diet, but he really is mindful and he makes sure that whatever he eats it in moderation. Currently, the patient is on vitamin D deficiency, vitamin D deficiency. He's also on Tylenol. He takes it 325 milligrams on PRN for pain, metoprolol for hypertension, ferrous sulfate for anemia. He has no known food or drug allergies, no seasonal allergies. He is immunized and all up to date with all his immunizations. No history, childhood medical history. For the adult medical history, he has hypertension, vitamin D deficiency, and iron deficiency anemia. He denies any recent traumas or illness. He denies any surgeries or hospitalization. Patient stated that all his past medical diagnoses were during his annual physical exams some years back. Patient stated he is sexually active and has a partner. Denies any mental health or psychiatric history. Patient stated he is happy and enjoying his life. Review of system was completed. So for the general, no fever, no chills, no unintentional weight loss or weight gain. He, productive cough with brownish sputum, affirmed sore throat, affirmed pain on swallowing, and affirmed shortness of breath. For the skin, no issues noted in the skin. There was no discoloration, no rashes, no bleeding. For his head, there's no head injury or trauma, no swelling in the head noted. There is no tenderness of the head, and he denies headache or dizziness. His eyes, no surgery, no eye pain, no abnormal discharges. Denies blindness or history of blindness in the family, no double vision noted, has no hearing difficulties, patient has no ear pain, patient has no abnormal discharges or ringing in the ears. For the nose, there is no nose bleed, denies runny nose, nasal discongestion, not noted at the time, denies any soreness around the nose and the face, patient affirms difficulties in breathing. He affirms pain on swallowing, affirms sore throat, affirms productive cough with brownish sputum, denies use of dentures, denies bleeding gums, denies tenderness, denies swelling neck or stiff neck. Review of systems, cardiovascular, no palpitations, no chest pain, the abdomen is no constipation, no diarrhea. He denies any abdominal pain. Patient affirms shortness of breath, denies wheezing, affirms cough, denies any tremors or involuntary movement. He denies history of seizures, no dizziness. Patient denies loss of consciousness or recent fall. No history of blood flow, denies any numbness in the legs. No bilateral lower extremity swelling, denies pain in the back or shoulder. Denies any changes in bowel movement or pattern, denies any blood in the stool, denies excessive taste, denies any heartburn, denies pain on urination, denies blood in the urine, denies lower abdominal pain or denies foul, swollen urine, denies lumps in the breast, denies bruising, bleeding, discoloration, no lethargy, denies weakness. Patient denies any endocrine issues such as diabetes or polydipsia or polyuria. He denies any anxiety. He stated that he is really happy. He's at the best prime of his life, no agitation. He denies any past history, psychiatric history. He denies any suicidal ideation, no depression, and denies any memory loss. For the objective physical examination, the patient presented well groomed, he's well dressed, calm, well articulated, he appears healthy, in overall good health. The vital signs we taken, they were pretty much normal, with the only abnormal vital sign was the temperature that was a little bit elevated, 102.8. The skin, he has no skin issues, no head issues, no eyes issues, no ear issues, no nose or throat issues. The issues that he had with his throat, when I assessed him, the throat, at the back of the throat, it really looks reddish and it was like swollen and had some white patches at the back of the throat. and he complained of the tenderness there at the back of the throat that he has when I palpated it. So the breath sounds clear on auscultation. He had no adventitious breath sounds, though he had some difficulties lying down. When he was laid down flat, he had some difficulties breathing. No chest tenderness, no pain, no regular. The heart rate is regular reading. Chest is symmetrical. Tonsillar lymph nodes palpable bilaterally with noted tenderness. No musculoskeletal issues noted. And for neurology, no neurological issues were noted at time of assessment. So diagnostic testings were done, and the diagnostic testing included lab diagnostics that were done. EKG was also done because of the shortness of breath that he had with laying down. So for the lab, a CBC, CMP without differentials, the rapid TREP test, rapid COVID test was done at the clinic. PCR test was also done, but we collected the PCR test after the positive COVID test, the rapid test, and sent it to the lab. The chest x-ray was completed to rule out infiltrate, and the chest x-ray came back. He had pneumonia. After the result of the chest x-ray was received, he had some infiltrates there, which the doctor decided that it was pneumonia. So the rapid COVID-19 test result was positive. Medical diagnosis one was streptococcus pharyngitis. Medical diagnosis two, COVID-19 positive. Differential diagnosis epiglottitis, infectious mononucleosis. Pertinent positives, we had sore throat, fever, white patches to throat, redness, cough, swelling to throat, pain while swallowing. Pertinent negative, absence of nasal congestion and discharge. For the plan, the referrals, currently no referrals were made because the patient was COVID positive and was really symptomatic. So we had to make sure that he gets home in order to quarantine for the period that he has to. But he was given azithromycin 250 milligram at the clinic, and then he gave another prescription for azithromycin was given to him 250 milligram, and he will be taking one tablet by mouth once daily for 4 days for streptococcus pharyngitis. He was given 0.5% normal saline liters for hydration. Tylenol 650 milligram every 8 hours he'll be taking for fever. Robitussin every 8 hours for 10 days for cough. 2 liters oxygen as needed for shortness of breath. Albuterol 2 puffs every 6 hours for shortness of breath. Zinc sulfate 220 milligram 1 tab daily for COVID-19. Education was provided to the patient before the patient left the clinic. Patient was educated to continue his regular scheduled medications as prescribed and to be compliant with medication. Patient will maintain standard contact and droplet precautions while quarantining at home. Patient surgical was encouraged to always wear surgical mask, especially when around individuals or in a crowd, and also encouraged to notify the loved ones. Surgical mat was provided to the patient, and patient was educated to always wear it. Patient will be notified of the result. Actually, the patient will be notified of the PCR test result when it will receive 1 to 2 days later. So the PCR test result was actually received and the patient was notified. It was positive. It was communicated to patient that it is not usual for someone who has been vaccinated to become positive, but the vaccine really helps because the vaccine prevents your symptoms to be severe rather than those who did not take the vaccine at all. Patient was instructed to continue taking oral fluids and food as much as tolerated. Avoid sharing cups, food, or drinks with any individual until after treatment is completed and patient cleared. Self-quarantine at home. Notify loved ones to watch out for symptoms and to do a COVID test. A follow-up telehealth visit scheduled in 48 hours, and the next visit will be scheduled thereafter. Patient will schedule a follow-up virtual visit with primary care provider and update primary care provider of current COVID-19 result. No in-person follow-up visit until cleared. If symptoms do not resolve or get worse, patient was advised to call 911 or go to the nearest emergency room. For the preventive plan, proper hand washing is key to preventing and spreading of infection or excluding bacteria and viruses. Using of hand sanitizers, often disinfect frequently used and touched areas. Avoid touching your eyes, nose, or mouth until after hand washing has been done. Wash hands before and after each meals. So patient was really educated on this and was notified that he is going to be self-quarantined at home for at least 10 days, depending on the symptoms. And he really doesn't need to be tested again because per the CMS guidelines, once a patient is positive, they don't require testing again till after 90 days. So we just go by the symptom-based precautions. So he should just continue quarantining at home insofar as his symptoms persist, and we'll follow up and he will be notified on when to be cleared. These are my references, and this is the end of my presentation. Thank you so much, Dr. Shane, for giving us this opportunity. Thank you.